Hello, and welcome to Digital Health Technologies Module 2, Lesson 2, Protecting Client Information in the Digital Environment. The Digital Health Technologies course is a product of the Grow Our Behavioral Health Workforce program at the Center for Health Innovation. Purpose. This lesson provides an overview of protected health information, abbreviated PHI, and how to protect client information in the digital health environment. Lesson objectives. Students who successfully complete this lesson will be able to recognize and secure protected health information in the digital health environment, and 2, describe situations and steps to share appropriate protected health information with other providers. Keywords include business associate, covered entity, encryption, and protected health information, or PHI. Lesson outline. This lesson contains the following sections. What is protected health information? What information is protected? And how can I protect my client's PHI? That is followed by a lesson summary, and don't forget to check your understanding with the lesson quiz after you are done. You may take the quiz as many times as you wish, but you must score 80% to pass. Section 1. What is protected health information, or PHI? PHI is personal health information collected by a provider organization about patients or clients and stored or shared in any way. It is also any information about someone's health that can lead to identification of that person. With these two components of PHI in mind, let's look a little bit further. PHI was defined by the Health Insurance Portability and Accountability Act, or HIPAA, as any health information that relates to the past, present, or future physical or mental health or condition of an individual, the provision of health care to an individual, or the past, present, or future payment for the provision of health care to an individual. That is transmitted by electronic media, maintained in electronic media, or transmitted or maintained in any other form or medium. Protected health information was embedded in law by the HIPAA privacy rule, which makes it a federal crime to share PHI without the patient's permission. It does allow PHI to be shared when needed for patient care and for other specific reasons. In 2009, the HITECH Act led to more electronic sharing of PHI and also widened the scope of privacy and security protections under HIPAA. So HIPAA manages this complex area by defining two types of organizations. One is a covered entity, and the other is a business associate. That means it's definition time. A covered entity. A covered entity is a healthcare provider, health plan, or healthcare clearinghouse that transmits certain health data electronically. A business associate, which is also defined by HIPAA. A business associate is an organization or individual who performs services on behalf of a HIPAA-covered entity that requires access to or the use of protected health information. Both covered entities and business associates must ensure the confidentiality, integrity, and availability of PHI. Protection of PHI is a combination of individual actions and cybersecurity measures put in place by your organization. Section 2. What information is protected? So while it's easy to say, oh, we're going to protect that personal health information, or the PHI, what are we really, really required to protect. This can be a really sticky point for healthcare professionals. So those two parts, as we addressed before, health information, any information about a client's health, past and present or future projection. And secondly, identifier, anything that could allow someone to match health information with a particular person. So if someone is in a study and they're studying the link between breast cancer and depression, if you can identify that particular person and say, well, their projection for their cancer is less than 5 months, and you share that information, that is a violation of HIPAA. On the other hand, if the study researchers say, well, we had 15 people in our study who fit this profile and 21 people who fit another profile, because the information and the identity of those participants is not revealed, then we're not violating HIPAA by sharing that information. So here are some of the common identifiers. Again, it's usually quite easy to recognize that this is health information, but where people can get tripped up is the idea of identifiers. Some of the common identifiers are date of birth, address, social security number, email address, and phone number. So those things are very common, and we learn pretty quickly not to share those because they can easily be linked to a particular patient and their medical and or mental health issues. Sometimes these things are overlooked though. One could be the MAC address of a network card on a device, or an IP address of a device. A driver's license number is also very easily identified. Biometric data like fingerprints or retina scans, which many of us use to log into our devices these days. Medical record numbers, medical device serial numbers. If you have a patient with diabetes, with an insulin pump, the serial number on that pump can be used to identify that patient. Health plan account numbers, dates of visits, admission, discharge, and treatment, payments and bills, photographs, diagnostic codes. I should also note that even old addresses and old phone numbers can be used to track patient identity, so never ever disclose those. Your general rule of thumb, if data can be used to identify a patient, it should be considered a possible identifier and treated as protected health information. However, PHI can be used and disclosed without permission when it is properly de-identified. To de-identify a record, all identifiers must be completely removed, so there must be no chance that someone reading that information could ever associate that information with a particular person. Section 3. How can I protect my client's PHI online? So, paraprofessionals, like other healthcare workers, are responsible for assuring PHI is protected. And this can be especially difficult because you're working in the field, you're working in homes, in the community, and sometimes just even you could be seen going in and out of somebody's house. You are still required to protect that patient's private health information. You are also likely to have to share information with other members of the healthcare team. This can present a conundrum. What can you share? What can't you? With whom can you share it? So your employer will set in place specific structures that will help you to protect that information. One is you're likely to have photo ID badges for all employees. There will be controlled access to patient records. If a patient or if a provider or team member actually is supposed to have access to that patient record, they should have it within the EMR or EHR system. Data will be encrypted in the electronic health record, apologies for the autocorrect there, emails, and other internal communications. Computers' data will be stored behind doors that lock or provide limited access. Shred bins are important to get rid of paper that has PHI on it. Encryption of emails. Encryption is basically turning the email into a code that cannot be read except for people who are within your system. Firewalls for computer systems to prevent hackers from breaking in. Password protection and automatic system log off are probably going to be found. So if you are using your computer and are not active for a while, after a while your computer will probably log off. And likewise, an automatic workstation lock. However, you play a very important part in protecting PHI, especially in the digital world. There are three things and three basic principles you need to follow to protect it. The first is confidentiality. Only share patient information with those authorized to view it. Information should never be shared or forwarded on without appropriate documentation. Just because some doctor shows up and says, oh, I can view that patient's record, you can't do that unless there's documentation that that person is part of the healthcare team and does indeed have the release to view that record. The second piece, which might seem to have nothing to do with healthcare, but is very important, is keeping your digital devices protected. That means using secure passwords and learning how to prevent cyber attacks. These are key to maintaining confidentiality. The second principle is integrity. Patient information cannot be altered or changed. Most electronic health records include a time date stamp that records when documentation occurs. If you've written something and you need to correct anything, clearly indicate why and when the correction was made while leaving the original documentation. So you may simply just be able to add an addendum, but you never ever erase or get rid of something you've already typed. Definition time. Here's another vocab word, encryption. Healthcare data encryption is a form of data security that disguises electronic health records so that unauthorized users cannot read or make sense of them. Encryption is also used for emails, texts, and many other forms of communication, just to assure that only people within the system can access them. And here's a need to know. Working at a facility does not automatically give an employee permission to look at health records of all patients. To view a patient's medical information, you must be a medical professional that is actively treating the patient or involved with planning the care of the patient. So there has to be a reason. If the nurse from upstairs decides to come down and ask about Joey, your new patient, just because she knows Joey's parents, it is not adequate. Only if she's a member of the team and release forms have been signed. Assure that you always get a release of information to assure continuity of care if need be. If you are passing care on to someone else, get that release of information so that the next person, with the patient's permission, will be able to view their record. It needs to be signed and uploaded into the EHR. Apologies again. Internal referrals. Do not use email or text messages. Instead, use the protected internal portal, which is probably your EHR or EMR, to exchange those messages. For external referrals, all releases of information and continuity of care agreements must be signed and stored in the patient's record. If you are lucky enough to work in an organization that has a highly functional EHR or Health Information Exchange, HIE, you can do all of this online and quickly. Finally, be selective. Only share pertinent information. Select which information to share and with which entity or individual. Even if you think that sharing a patient's PHI falls within the acceptable uses, or there's already a release on file, take the extra step to assure the privacy and respect for the client. So before you share, ask the client, is it okay if I speak to your provider and other people who are part of your team about X? Get their permission. And document the response and share the information only via secure encrypted channels. So here's a summary of what we've just covered. Lesson summary: protecting client information in the digital environment. Protected health information, abbreviated PHI, is the personal health information collected by a provider organization about patients or clients and stored or shared in any way. PHI is any information about someone's health that can lead to identification of that person. In 2009, the authors of the HITECH Act recognized that the act would lead to more protected health information, or electronic PHI, being shared electronically, and widened the scope of the HIPAA Privacy Act. Under HIPAA, PHI is defined in terms of two types of organizations that collect and share health information. These are a covered entity and a business associate. There are two components to PHI. One is health information, and the second is that unique identifier that matches a particular person. Health information is any information about a client's health, past, present, and future. Identifiers are anything that could allow someone to basically put two and two together and match health information with a particular patient. Lesson summary: what you should expect. As a behavioral health paraprofessional working for a covered entity or business associate, you are responsible for assuring PHI is protected. All healthcare workers are expected to maintain confidentiality and integrity. Maintaining confidentiality means to only share patient information with those authorized to view it. Maintaining integrity means the patient information cannot be altered or changed. Your employer will have policies and procedures to assure security of digital and paper information to help you comply with HIPAA privacy rule. And here are 4 steps you can follow to avoid the digital pitfalls that can lead to PHI getting into hands it shouldn't be. First, ensure you have appropriate releases of information to assure continuity of care. 2, do not use email or text messages for referrals. 3, assure that all releases of information and continuity of care agreements are signed and stored in the patient's record. And 4, only share pertinent information. The EHR allows you to select which information to share and with which entity. Let's pause for a moment to reflect on health tech. Again, you don't need to submit anything, but take a moment, pull out a pen and paper to write a few ideas down. Discuss your answer here with a friend or a family member, or simply reflect on it yourself. This is about your chance to ponder and think about what you've just learned in this lesson. You are in the middle of documenting your last client visit when you reach the bottom of your cup of coffee. You step away from your desk for a moment to get a fresh cup. The coffee machine is around the corner from your cubicle. How do you assure your client's PHI is protected and you have adequate caffeine intake? So go ahead, pause for a moment, and think about how you might handle that situation. Thank you. This is the Digital Health Technologies course from the Grow Our Behavioral Health Workforce program of the Center for Health Innovation, developed with funding from the Health Resources and Services Administration.